Hi, welcome everyone. Welcome to the training. It's a pleasure to have all of you here. And we can start with a poll. I'm Amitabh Saxena, and once again welcome you. And we can start with the poll. If you can just answer a few questions for us, so that it is more meaningful, and the session will be more useful for you. So, are you currently working in the healthcare field? Yes or no? So it will tell me which examples I should be taking. Of course, the certificate is for entering into the healthcare if you are not in healthcare. And those who are already in healthcare, they can always enhance their careers. Okay. So thank you for answering this question. And if you can go to the next question, please. Are you currently working in the, thank you for answering this question. And are you currently preparing for the CPHQ exam conducted by NHQ? So if you are preparing, I will speak a little bit more about that aspect. If you are not planning in the future, some of you are planning in the future. Yes, many of you are planning in the future. So I will give you a brief idea about CPHQ also, although I'll not go into the details of what the exam is, etc. Very brief idea I will give for those of you who are interested in preparing for the examination. Okay, so there will be quite a few of them. Okay, next question. What is your role in your organization? So I will accordingly take examples. So we have people who are administrators, nurses, students, technicians, physicians. Okay, great. Thank you. Thanks a lot. Thank you for participating in this poll. And yeah, yes, so we see that it's all balanced. Okay, fine. Is there any other question? Yeah. What is the biggest challenge in healthcare quality in your organization? Yeah, so I see that time constraints, workload pressure is also figuring one of the highest. Lack of staff engagement also, lack of clear KPIs, okay, and every other challenge is also represented here. So I can understand that, and CPHQ addresses all of them. Okay, the next question. Is there any other question? Okay, great. So thanks a lot, and thanks for participating in the poll. Okay, a formal welcome to you. I'm Amitabh Saxena, and this is just a video introduction. In case you can watch it for a while, that will give us some more time, because I think people do take time while they are you know joining. Usually, sometimes people face some difficulties joining. Sometimes they are uh, they have to be reminded about it. So yeah. Okay. I'll also introduce myself in a little bit more detail afterwards.
Hi, welcome to Anexas. Anexas has been consulting and training the professionals in the organizations around the world since 2006, and we have trained more than 150,000 people and consulted for more than 500 organizations, which includes Fortune 100 organizations too. I'm Amitabh Saxena, and I have designed this program based on my 30 years of experience while working in various industries across many domains. The whole Anexas team once again joins me in welcoming you.
Okay, so our agenda would be, we'll start with the what is CPHQ? As some of you are interested in appearing for the exam, and maybe you are not knowing uh, basic information about the exam, I'm just assuming. So in that case, it will help you. But as I said, I won't spend too much time on that. I've got a separate video for that, and that's on our Anexas channel. If you are interested, you can watch that. I'll strongly advise you to become a member of Anexas channel. Just subscribe to the channel, and you will get lots of information, lots of tools and techniques used in CPHQ and otherwise quality are given there, and you can always have a look at them. We'll start with the introduction to the different modules of CPHQ examination. And then after that, we will look at, while seeing the modules, the fifth and sixth modules, which correspond to the statistical part. So there are 7 modules, but the 2 modules constitute almost 50% of the questions, and they belong to data analytics part. So because of that, because in healthcare profession, you have studied most of the topics except the data analytics part. So sometimes people don't succeed in the examination because of that portion. So I will cover that topic, which is considered as the most difficult topic today, so that you get an idea and you also get something out of this course. And those who want to join our regular program, they can always let us know, and you can join a regular program also. About the organization, we have been enabling individuals and organizations achieve excellence since 2006, and we have trained more than 150,000 professionals: Lean Six Sigma, CPHQ, project management, AI, data analytics, Power BI, etc. And these are some of the pictures to prove. And I also take pride in telling that I conducted the first ever Lean and Six Sigma black belt training in whole of Middle East. And incidentally, that was for a hospital back in 2007. And later on, Ministry of Health of Saudi Arabia, and then after that, Ministry of Health of UAE, Qatar, Kuwait, etc., along with Ministry of Health of China and Vietnam and the UK. UK is known as National Healthcare Service. We have done lots of training program. So these are some of the photographs just to prove that I have done training programs worldwide and received lots of awards for that. And yeah, this one is something from a CPHQ professional's perspective, this might interest you, because we learn lots of tools and techniques in CPHQ. But when you are, certification is one thing, but if you use these tools and techniques, you can improve the hospital's processes, save the cost, and also improve the patient safety. So everything positive happens when you apply these tools and techniques. One of the high-end, we are very well known for as a Lean and Six Sigma certification company. People in Middle East are already aware of. Those who are attending not from Middle East, for them, I can tell you that we are the #1 certifying company in Lean and Six Sigma in whole of Middle East and Australia and UK. So the CPHQ tools and techniques, you'll be learning lots of quality tools. And if you apply these quality tools, you can improve the processes. So this National Healthcare Service, I had done implementation of training as well as implementation of Lean and Six Sigma along with CPHQ trainings. And see, in that case, if in CPHQ, you are just examined for your knowledge, but in Lean Six Sigma, you are also examined for application of that knowledge. So this is a individual who's talking about the benefits of the tools and techniques which we teach in CPHQ.
Well, we have Alex with us, and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So, Alex,
Would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvement at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
Yes. And I have also conducted training programs for US professionals, and they have passed the CPHQ examination. CPHQ examination for US professionals is a little different. And there also we have got 95% success rate. In Middle East, we have got 95%. Plus in US also, we have maintained that. In Australia, it is 100%. And in UK also almost 100%. So with that in mind, and of course we have got lots of videos, but I'll not be, now I see a lot of people have joined in, so I will not spend too much time on videos, but maybe the last one I will show. Okay, yeah, American Society of Quality also. I have presented multiple case studies where we have reduced the nosocomial infections, plus lots of other benefits we have incurred in the hospitals. And I presented in American Society of Quality about these tools and techniques. Dr. Tarif Alama, Deputy Health Minister of Saudi Arabia then, and now Dr. Mohammed Abdul Ali, he's our Deputy Health Minister again. They have all attended our training programs along with their teams. Well, I think let me proceed. And let us talk about very briefly, I'll talk about what is CPHQ. CPHQ stands for Certified Professional for Healthcare Quality. It is an exam conducted by NAHQ. So NAHQ is National Association for Healthcare Quality. It's a membership and certification organization, and it has got an approximately floating population of around 19,000 plus minus 1,000 professionals who are certified at a given point of time. Why it is a floating population? Because some people don't renew the certificate. So because once people get the certificate, they say, yeah, it is for lifetime, and they don't want to renew it. That is why, the overall we have 18,000, but in general, lots of people have been certified. And we are proud to tell you that we have more than 5,000 certified professionals from Anexas who are proud CPHQ professionals today. I will not go into the very detailed descriptions, but very quickly. And I have got a separate video for that, which is there in our Anexas channel about CPHQ examination. So I'll not spend too much time here. We are here to learn today. So that is why I'll focus more on that. But just to tell you that there are total 140 questions. So there are 140 questions, and they comprise of 125 scored questions plus 15 pre-test questions. These pre-test questions, they don't carry any marks, but you don't know where these pre-test questions are hidden. So they are all mixed up with 140 questions. So we strongly advise people who are appearing for the exam that don't spend more than 2 minutes on any question. Don't spend more than 2 minutes on any question, because you don't know whether that is a scoring question or non-scoring question. And second thing, if you still have time, you can always come back to those questions which appear to be difficult. But we prepare you so well that you are able to answer all the questions very easily. We also teach you how to use AI to prepare for your examination. Although it's not a big deal, everyone uses AI, but also we tell you what prompts you can use, how you can prepare for the CPHQ examination. Once you complete our training program, how to prepare for the CPHQ examination. Just to quickly take you through the 7 modules. So there are 7 modules, which are, the first module is Quality, Leadership and Integration, which carries 19 questions. And I'll just take you through that. And after that, I'll come back So the first module is about quality, leadership, and integration. Second module is about quality review and accountability, which carries 16 questions. Patient safety, third module, carries 18 questions. Regulatory and accreditation, 8 items, 8 questions. And performance and process improvement, 27 questions. The fifth module has 27th question. And similarly, sixth module has healthcare data analytics, 26 questions. So these are the two modules which carry most of the questions. And that's what I was telling in the beginning. Those who joined a little late, for them, I'm repeating. These two are the most important modules, and they are considered to be very difficult modules. So today we'll be covering some of the topics. Those who are preparing for the CPHQ examination, they can get some good knowledge for this from this session today, and your chance of passing the CPHQ examination will definitely improve. Then we have seventh module, which is about population health and care transitions, which has been introduced only the last time in 2023 when the course was revised. Then that time the seventh module was introduced. Earlier, there were only 6 modules, and I have been conducting this training for last 18 years. And I have seen lots of people from my batch pass the examination, and I'm sure you will be also one of them. Okay, so if you are interested, I can very briefly talk about all these modules, and then we will go to the fifth and sixth module. See, as a CPHQ professional, you are an internal consultant to your own clinic or hospital, polyclinic or lab, or wherever you are working in the healthcare setup. You are your own internal consultant. What does it mean? You can advise the senior leadership on how to improve the quality. You can also advise the leadership which improvement projects you should be taking. And see, when you want to improve something, whenever you want to improve something, improvement can happen if you follow project approach. Project approach. What do you mean by project approach? There's a difference between process and a project. Process is something which is repetitive in nature. Like treating a patient is a process. Surgery is a process. Discharging a patient is a process, because you keep doing this again and again. But what is a project? Project is something which you do only once. It has got a starting point and it has got an end point. So how do I improve my process? The best way to improve our process is to use project approach. So, for example, I want to reduce the patient discharge time in a hospital. So I would say that today the patient discharge time is, let's say, 5 hours, and we would like to reduce this 5 hours to 2 hours after 3 months, by the end of, let's say, by August 31st. So you have got a schedule, you have got a target, you have got a duration in which you will be completing the project. So you will reduce the 5 hours, the time taken to, if I write it here, 5 hours to 2 hours by, and you have a duration in the next 3 months. So within 3 months, you will reduce. So that becomes a project. And this, we are doing a project in a process. What is a process here? Patient discharge process. So how would I improve the patient discharge process? There are multiple things. And I choose one of the measure, which is patient discharge time, and we do a project. I will talk about this a little bit more after we start learning the topic. But before that, just I wanted to tell you, as a CPHQ professional, you can tell the management which are the best projects, which will have the highest impact, so that you can achieve the vision of your organization. Then review and accountability talks about lots of topics like clinical practice guidelines, pathways and outcomes, the documentation part, maintaining confidentiality of performance, etc. Most of the people don't fail in this particular module. And we have patient safety. Most of the individuals easily answer all the questions in patient safety. If you have spent at least 3 to 4 years in the hospital setup, this module is very easy for you. So here you learn about participating in safety and risk management activities related to safety event, incident reporting, sentinel, unexpected event review, etc. So this is a very, very simple module for those who have at least 3 to 4 years of experience in the healthcare industry. For those who are new, this will be a new topic, and obviously you will have to study this topic a little bit thoroughly. And then you have got regulatory and accreditation, how to prepare your setup for the accreditation purpose, like JCI. If you are in Saudi Arabia, then Sibahi, and respective organizations, respective countries, you have got the accreditation bodies. So how to prepare for these accreditation journey, you have to, you can, talk about this. You learn about this in the regulatory and accreditation. And again, not many people fail in this. There are only 8 questions, and most of them people are able to answer. The difficult part is the performance and process improvement. So most of the healthcare staff is not trained as a day-to-day operations. They are not trained in this area, performance and process improvement, and the other one, which is healthcare data analytics. So this part is something which is most important. And we, as a well-known Lean and Six Sigma company and a CPHQ training provider for the last 20 years, we are very well known for our training and making you 100% confident in this area, because the best part about these questions is there's a simple yes and no answer. Like yes or no means it's a 2 plus 2 is 4. There could be no other answer. So once you understand this, you get 100% marks in this. Because in leadership related questions, there could be all answers appear to be almost correct. So it's very difficult to select the right answer. You have to apply lots of experience, logic. You have to look for the words, right word, etc. But in these questions, 5th and 6th module questions, around 56 questions, it's very, very easy. So very, very easy in the sense, once you understand, then it's very easy to score 100% marks in those 2 modules. And if you do that, your 80% job is done. And that's good enough for you to pass the examination. Some people ask, what is the passing marks of this exam? So they don't tell us what is the passing marks, but very, very quickly, I can tell you that because the questions given to every examinee are randomly generated through AI. So if the AI finds that you have got I'm just giving an example. If all the questions given to you, you are lucky, every question is all the questions are simple, then your passing marks would increase. Let's say 75% you have to score to pass the examination. But suppose you are unlucky and you got all the difficult questions. Usually it will not happen like that, but I'm just taking an example. So if you got all the difficult questions, so then in that case, your passing mark would, the threshold limit could be maybe 60%. And this was just an example. These numbers are not revealed. So don't worry about passing marks. That's what we advise to our students. Don't worry about passing marks. Prepare so well and be confident you'll pass the examination. So with that in mind, so these are the different topics. You learn about Lean, PDSA, Six Sigma, fishbone diagram, FMEA, failure modes and effects analysis. Today, I'm not sure we have enough time to teach you FMEA, but if not, I'll just request you that you please watch my video on your FMEA. I have explained it in 15 minutes video. 15 minutes video using a very, very simple example, a day-to-day life example. I've explained FMEA, and then you can apply it to your own process, and you will see a great difference. It's just go back next week, do an FMEA on any issue which you are facing, and you'll see the difference. You can get excellent ideas, and you can also implement them to get the benefits. So FMEA video will be given here by my team, and I'm just seeing that my team will be putting the link. So please store these links. They are very, very useful for you. And by the way, just to motivate you, this video. I prepared this video around 4 years ago, which I'm sending you the link, and it has got 2.3 million views around the world. So it must be good. So I'm just trying to motivate you that please do watch, even if you are not appearing for CPHQ examination, but this is a very, very useful tool. And please do watch this FME analysis, this video, for your own benefit, for the benefit of the hospital. And of course, if you are appearing for CPHQ examination, 2 or 3 questions are likely to appear from this topic. So please do watch. I'm strongly recommending. We will give you lots of links, but some of the links are very, very important. If you are aware of Pareto chart, I will tell you what is Pareto in a short while if you don't know. But if those who are aware, 80-20 rule, right? 80% of the important topics we cover in our training programs. No, I'm not talking about today. In our regular training programs, we do a 4-day training, of 4 to 5 days of training of FMEA. Also, not sorry, FMEA. I'm sorry, CPHQ. This CPHQ preparation course, and so this is a 5-day course usually we run, and it depends on the timing, but it happens every Saturday. Every Saturday, and Sanjana is telling that please send the link once again. So please send. My team can send it one more time. Okay, so yeah, thank you, Razi, Tristan, for your yes. I see Abu Bakr, Sarfraz, a lot of I can't name everyone. There's lots of people joined in now, so I can't name everyone. Sorry for that. I can read your messages in the chat box, but I'll not be able to, respond to every question, maybe, or every response which you are giving me here in the chat box. Thanks a lot. It just tells me that you are there, you are out there. I'm not speaking to the, just to the camera. So your presence is always valuable, and keep writing. Great. So this, I was talking about the FMEA. Please do watch. And apart from that, lots of techniques you learn. Today, I will take you through some of the concepts of maybe lean, and some of the concepts which we apply in healthcare quality. Then data management systems like mean, median, mode. Yeah. The general data analytics basics, basic statistics like mean, median, mode, standard deviation, normal distribution, and also we take it further a little bit to correlation, regression, and some of the introduction to hypothesis tests. So this part also we cover control charts, trend analysis. Today, if time permits, I will give you the foundational training, or maybe full training on control charts. Maybe let's see how much time. If you're willing to stay for longer time, I will be happy to teach you even the control charts. Enough for the syllabus, which all the control chart related topics I can cover today, if you are willing to stay a little longer. So maybe we'll see how many people are still around, how many people still stay on till the end. I'll strongly recommend that you please stay on till the end. You'll be getting a certificate. Also, one more thing, when you attend our training program, the full training program, just give me 1 minute. So when you attend our full regular program, you also get certified healthcare quality expert certificate, because you have demonstrated the understanding of healthcare tools and techniques. And once you pass the examination, you will be getting the full-fledged certificate of CPHQ. CPHQ is conducted by NHQ. Yes. Okay, so I think I have given you enough information. And the last module is about population health and care transitions, which also talks about collaborating with the stakeholders to improve and optimize the care processes and transitions. And it also talks about identifying the data and resources that are important in determining the health status of defined populations. Okay, so I will start with organizational leadership. Now, those who joined little early, before time, you must have noticed our team was playing a video of leadership. Yeah. There are 5 levels of leadership, and I'm sure some of you have seen that. So the first topic, let us talk only about systems thinking. Yeah, we can begin with that topic. So the first module, let me talk about only systems thinking. Then we'll move on to the topics of the module 5 and 6. What is systems thinking? As a leader, see, you are a leader. As a professional, you are a leader. Leader doesn't mean that only the CXOs or the CMOs. Everyone is a leader. And as a CPHQ professional, healthcare quality professional, you are also an advisor to the governing body of the hospital or your setup. So you have to have systems thinking, and not only you should have a systems thinking, you should also inculcate, you should also sort of train your senior management in systems thinking. Apart from other staff members, you should propagate the systems thinking. So let us see, what do we mean by systems thinking? So systems thinking is, think of your setup, the hospital setup, healthcare setup, lab, as a system. So I'm drawing a basic systems map of any organization. So if you see, there are certain inputs. This is a model. Through series of departments, these inputs are processed, and then we produce an output. Yeah. So we have inputs, we produce outputs. And there are multiple processes like these. So let us think of the bigger picture. Patient treatment is a process, right? So if we talk about patient treatment, and if I take let's say a large hospital, if I create a systems map of a very large hospital, the inputs could be, and you can write here, you can, it will be a good idea to participate. You can write here, if you can just tell me, what is the output? Very simple. Let's start with the outputs. What is the output of the patient treatment process or a typical hospital setup? What exactly they're trying? What is the output? See, output could be service, or output could be the product. Okay. Can you tell me what could be the possible outputs of a patient treatment? Patient recovery, yes, Asma, you're right. Patient recovery. What else? Yeah. Yeah, you can participate. Everyone can participate here. Yeah. Treatment, yes, treatment. Okay. Patient trust. So here, you will have some outputs. Now you have to measure. You have to measure those outputs. Okay, my team is telling me I did not tell about. Yeah, usually I stay in either Australia or Middle East because most of my clients are here, and I have done lots of projects, improvement projects in Australia also. So thank you for reminding. My team was telling me that I forgot to mention that, but I had mentioned enough in the beginning. So okay, so let us continue. Yeah. So see, a treatment. Now, so this service or a product, whatever, it could be some, let's say if you are a lab, then you are giving a test as well, records, documents. So they could be either documents, they could be a treatment, they could be recovery. So all these things, all these outputs have to be measured. So you have a measure. We have measures on these outputs. Remember that. We'll come back to that. But before that, let us complete our systems map, right? We were about the system. We are talking about the systems thinking. What is systems thinking? As a leader, you have to have systems thinking, not silo thinking. What do you mean by that? These outputs, they are consumed by the customers. Now, please understand, customers are not only patients. There are other customers also, like family members of the patient. The government, in most of our cases in healthcare, government is one of the main customers. The shareholders of the hospital, if it's a private hospital, the shareholders are also one of the main customers. So the outputs are consumed by the customers. And of course, the suppliers provide these are the suppliers. Suppliers provide the inputs. And the customers will give feedback about our products and services. This is our feedback. Yeah, feedback. And a strategy or planning team, strategy team or a planning team will inform the suppliers to provide the necessary inputs, and also they will predict the demand, how many patients are expected, what kinds of ailments are prevailing in a given season, etc. Based on that, they will plan, and then they will ask the suppliers to provide the inputs. Suppliers could be the HR firms as well, who provide you the staff. Of course, the pharmaceutical companies who provide the medicines, etc., etc. Apart from, of course, the most important input to the whole process, the patients. So patients are so inputs example are patients, yeah, the medicines, staff, physicians, nurses. They are all inputs to our process. Standard operating procedures, all these things, all these are inputs to the process. And then we have a process. So these inputs undergo a series of steps. They are processed, you can say, in a way. Their process, patient is processed through the whole process. Patient is treated in different steps. So department A, department B, department C, department D. And once you get the treatment, obviously the end result, intended end result, is the customer satisfaction. Government, if it's government satisfaction, stakeholder satisfaction, and of course, most importantly, the patient satisfaction. I hope you are with me up to here. Now, this is how our system operates. This is how our whole system operates. You should have a systems thinking, means you should not have a silo. You belong to a department B. Silo thinking means I come to my department, I don't care what's happening in A, what's happening in C. I complete my job, I'm happy with my job. I don't care what's going on in A and C. And then, I'm in my own world in a way. That's what I'm trying to say. This is not a silo approach, but as a leader, you should have a systems thinking. Lots of applications are there of systems thinking. I'll not go into the details of this, but based on the systems thinking, your total mindset change happens. Once you have a systems thinking, you are not thinking about the parts, but you are thinking about the whole. And this map is also known as systems map, given by Dr. Edward Deming. Systems map given by Dr. Edward Deming. Although in your syllabus, there is some chapter on quality gurus like Dr. Edward Deming, Bruna Bedian, Joseph Juran. Generally, they don't ask any questions on that. So we don't stress too much upon those topics. And when you come to our sessions, we teach you the most important topics which are relevant from exams perspective. So our whole training is designed to pass the examination. Yeah, definitely you'll get the knowledge, a lot of knowledge you'll be getting, but whole training is designed to pass the examination. And also we tell you how to use AI while you're preparing for your examination. so that you don't fail. Earlier, we used to give a lot of mock exams. We used to take pride in giving, a lot of mock exams they're giving, so many mock exams. They're still there in our website, of course. But you have AI today. You can create your own mock exam. The best part is you can write. I'm just giving you a tip in the chat GPT, right? I'm just giving you a very basic tip. Of course, when you come to our sessions, we tell you lots of other things as well, but a very basic tip that tell ChatGPT that you are preparing for a CPHQ examination. These are your timings. These are your hospital timings. These are work timings. These are your off days. And I've got this much window, and I'm targeting to write the exam, whatever date you're targeting. You give that date, and it will create a great schedule for you. Yeah. So what we generally tell you, what we generally see, we give you all the most important topics. We train you in most important topics. And once you have learned those topics, don't have to read too many books. There are so many thick books, 600, 1,000 pages. I'm sure you are aware of those documents. There's NHQ, like HQ Solutions. Then there is Janet Brown. There's so many books. They're all so thick. If you have got a lot of time with you, please go and read the books. And we're not discouraging you from reading the books, but those who don't have much time, we have pulled out the most important portions, and we teach you. We are aware based on the data. Again, we use AI here. Based on the data, we know which areas are most important, and we teach you in those areas. And with that minimum preparation, you are able to pass the examination. So, okay, I just left you with this page, and so that the knowledge sinks in your mind. Systems map, system thinking. There's another name for this diagram. Some of you might be aware of. It is a popular name for this diagram. It's also known as value stream map, VSM. Okay, VSM, value stream mapping. Short form is VSM. Okay, so this is what systems thinking means. So just to tell you, let us say patient arrival rate. Let's say you are getting, I'm just taking a simple example. There are 6 patients per hour. Okay, patients are arriving, 6 patients per hour. Okay, and let's say one shift, 8 hours shift, 48 patients are arriving. Means every 10 minutes patient is arriving, right? Now, if you design your process like every 10 minutes, 10 minutes, 10 minutes, 10 minutes. Now, once the patient enters into the system, the patient will never wait anywhere. 10 minutes, the first thing, like whatever, it could be triage, it could be collecting the information. And second, again, 10 minutes, 10 minutes. So you can see that there is a flow in the system. Okay, there's a flow in the system. So this is one simple, application of the systems thinking model. See what may happen. Departments, let's say, Department C manager, he or she attends a conference. There are so many AI conferences going on. I'm myself a speaker in lots of AI conferences. AI in healthcare is my specialty. There's a 4 years ago, you can see that video. 4 or 5 years ago, I had made a presentation, and it is very much there on our channel also. AI in healthcare, and it's still very much seen by people. And just 4 years, I'm talking about 4 years ago. You can see very basics. If you are totally not aware of anything about AI, I'm not talking about a ChatGPT, etc. They're nothing. They're AI in healthcare. If you want to know some basic fundamentals, you can watch that video also. So in that, when I had done that program, I had given certain examples that time, and they're still valid. And you can see, those days also we were able to, visualize certain things which are happening today. Okay, coming back. So let's say 10 minutes, every 10 minutes, the patient is arriving. So every 10 minutes, the flow is super. But a department manager, department manager attends an AI conference somewhere. and he finds some, some automation tool, and he or she finds that, if you, it costs you, say, let's say $100,000, and then they get that, and they reduce the time, whatever time was being spent 10 minutes to just 2 minutes. Do you think it is going to help the patient? Do you think it is going to help the system? Tell me yes or no. I reduce the time from 10 minutes to 2 minutes. Will it impact the system? Will it help the hospital? Will it help the patient? Some people are saying yes, some people are saying no. The answer, okay, let me tell you what happens. Every 10 minutes patient is arriving, right? Now C, which was taking 10 minutes, finishes in 2 minutes and gives to D. Now D is still taking 10 minutes. D is still taking 10 minutes, right? So what will happen after some time? There will be a queue, waiting time in front of the D. People will start blaming D. You're not doing your job. There's a lot of patients, right? Every 10 minutes, patient is arriving. But patient has finished the job in 2 minutes. So this is not going to help reduce the waiting time and the patient dissatisfaction. Please understand this. Okay. Another example. Okay, let us go back to this. It is still 10 minutes. I'm going to the original example. And let us say this is 20 minutes. Somehow it is delayed. What will happen? You will find a queue here, waiting time here. See, we start blindly impacting the waiting time, blindly reducing the waiting time without even knowing what is the root cause. So systems thinking will help you here, and that's what I just wanted to tell you. Of course, I can't go in the details of how it can be done, etc., because I have to give you lots of introduction to lots of other topics. But this system thinking is one thing which is propagated by CPHQ. Okay, so I hope some of you got the understanding, and you can always watch this video. The recording will be there. You can always watch this video one more time, and I think you'll be able to understand this in more detail once you watch it again. Some of you might have understood what I'm trying to say. Some of you might be new to the topic. So for them, I'm just telling you that please watch the video one more time. Okay. And of course, there are variations in the, patient arrival times, etc. Lots of things, everything can be managed. But in CPHQ, you don't worry too much about this. CPHQ is a very, very simple examination from that perspective. But when you join our other programs like Lean or Six Sigma, by the way, you can also register for our Lean and Six Sigma Green Belt, Black Belt, and CPHQ combination. And it's a very, very, almost 2 certificates, you get it for free. So if you register for 1 or 2 or 3 or 4, it depends on how many you register, you get other certificates for free. So we'll be talking about that towards the end. Those who are interested, they can always stay until the end, and I'll talk more about it later on. Now, having understood the systems thinking, and first module, I just wanted to cover one. Similarly, there are other topics, very easy, nothing complicated. Please understand that CPHQ is a simple exam. They just want to test your concept. They just want to check whether you have understood the concept. So if you understand the concept, you will be able to answer all questions. So don't have to really solve too many mock exams or mock questions. And you can go on and on reading the material and solving mock exams. You're not going to go anywhere. But if you understand the concept with full confidence, you can tackle any question. So that's the whole focus of our training programs. Okay, coming back, let me also talk about a little bit of lean concept, which is, I was talking about the queue, the waiting time. They are all known as wastes. So in the systems, when you do a systems map, system thinking, you can identify the waste in your hospital. Now, we are not talking about the waste which we throw in the dustbin. We are talking about the waste which is present in our processes. So there are typical ways some of you might be aware of. Nowadays, it is such a widely known phenomenon or concept that people have at least heard of it. So I will directly jump to that without giving too much of background about it. So let me talk about the wasteful processes. Okay, I'm picking up few topics depending on the way you had answered the questions at the beginning. I had done a poll. Those who joined a little late, we had done a poll, and based on the poll, I'm going to pull out some of the topics from our CPHQ material, and one of the topics is lean. Lean is about reducing the waste. Now, there are different types of waste. To understand very simply, there are, you can say, 8 types of waste. Waste of intelligence, waste of rework, waiting, inventory, motion, transportation, overproduction, overprocessing. Now, these are typically taken from Toyota in Japan, but they are easily applicable. And for the last 20 years, I have been consulting for Lean and Six Sigma for multiple hospitals. In the beginning, I had shown you National Healthcare Service and lots of biggest names in hospitals in Middle East, ranging from King Fahd Medical City, IMC, then Dr. Sulman Habib, then we have got King Fahd, KSUMC, King Saud University Medical City, and lots, more than say, because I'm a little old, so I've got 35 years of experience. So obviously, I will. The list of the clients is really, really large, and many of my students, I'm proud to say, they are now CXOs, and they keep giving me the business. Just they're trying to help their old teacher, you can say that. And yeah, so just coming back, oh yeah, one more thing. If you want to remember these tools, you can say I swim to, or if you rearrange these words, it is also known as STEM words, whatever you prefer. So these are the 7 or 8 ways. But yeah, let us see the examples. And sorry, I'm doing a little fast because I want to cover more topics. This topic, this program, this workshop is only for giving you the glimpses. This is only, it's not designed to teach you the tools and techniques in detail. It is just to tell you give you an introductory knowledge about various topics which we cover in CPHQ. So I will just jump and let's take an example. See, what is waste? Waste is anything which is not adding any value. Waste is anything which is not adding any value. So what is adding value? Anything which the patient is willing to pay for or customer is willing to pay for. Yeah. Customer is willing to pay for. And anything which you do right the first time. So right the first time. Yeah, it should be done right the first time. So this is value added. We call it as value added. And what is non-value added, or we call it as waste? Opposite of it. Customer is not willing to pay for. It is not done right the first time, means there's a rework. You commit a mistake and then again do it. It wastes your time, wastes the hospital's resources, and also increases the cycle time. And also this, see, you have to identify the value. Why we are performing some activity. See, patient treatment. Okay. Patient treatment. See, patient is not here to take the medicine. Patient is not here to take the prescription. Patient is here to improve the health. So improvement of health is the value. So focusing on the value, you have to think on the value, about the value, and say whether this step is bringing me closer to that value or not. So for example, lab test. What is the value? The value is, I want to know the status of my health. That is the value from patient's perspective. But if I tell the patient to go to this counter and another counter, then do the registration, and then move from one place to another place, this is not adding any value. Okay, so please understand, value is something which brings closer, brings the input closer to the valuable output. Okay. Sorry for the bad handwriting because I'm in a hurry. Valuable. Okay, valuable output. So if it is not bringing it closer to the output which is of value to the customer, it is a waste. So let us see. Walking is a waste. I'll just make it fast forward. Only the two are value-added activity, remaining are wasteful processes. Checking, inspection, they are all waste. Now you will say, should I stop checking? No, I'm not saying that. See, why do you check? Because you know people have committed mistakes. When I know my people commit mistakes, I will check. When I know the people don't commit mistakes, I will never check. Isn't it? So checking is considered as a waste. I'm sorry to say that. Some people are surprised to know that. You can't check. I've been told to check 2 times, 3 times. Why? Because your system, the current system is such that it is producing errors. It is producing mistakes. Because you are producing mistakes, you are putting checks. You should not think of improving your inspection. You should think of reducing, eliminating the errors. Okay. Some examples of waste. Some people have raised their hands. Can I take the questions a little bit later? You just write the questions in the Q&A and we'll park it. So it will not break the flow. And what we will do is we'll take the questions towards the end. I'll be happy to answer. Some of the questions will be answered automatically during the session. So, and my team also keep telling me how much time is remaining so that, I lose the... When I'm into flow of the training, I just lose the sight about the time. So please, if you can let me know that. Yes, coming back. Waste of intelligence. If you remember, the first waste was intelligence waste. 80% of the nurse calls are housekeeping in nature. It means my bed cover is dirty, pillow cover is dirty. Now, this is waste of intelligence of nurse. So this is waste. So there are so much of waste in the processes. Yeah. And yeah, I will just take some few more examples. We were able to double the cardiology lab capacity from 8 to 16. Yeah. Reduce the diagnosis time, diagnosis to exam time from 2000 minutes to 64 minutes. Cutting down the admission time from 17 minutes to 5 minutes. Reducing the signatures or steps. We have done multiple projects, and you can check out about our work in various conferences and forums. We have done lots of work. Approvals is a waste. Signature at every step is a waste. It is not adding any value. Think about what value approval is adding. Nothing to the patient. But you will say, no, someone committed mistake 10 years ago because you don't want to repeat that mistake. 10 years ago, someone committed, you put a approval a process in between. Someone committed a mistake 5 years ago, another approval step. So you have multiple approval steps. People don't know why we are doing the approvals. Things have changed. Technology has changed. Process has changed. But still we are continuing with the approval process. No one knows why. People don't even check while signing. They don't even check. This is all waste. So try to reduce the waste as much as possible. So we are talking about the waste part. Let me also give you some examples of some more examples of waste. Unnecessary waiting, unnecessary process, motion, etc. And underutilized resource or overutilized resource, both are a waste. Similarly, underutilized equipment and overutilized equipment is a waste. Okay, anyway, so on the funny note, cost of a 5-minute MD walk, it's a waste. Some more examples. So a typical waiting time in front of the elevator, if you calculate, it's giving you $12 wait per day per nurse, multiplied by 200 nurses, multiplied by 365 days, it runs into some few millions of dollars. So these are all examples of waste, and we can think of reducing. So that's just one thing I was talking about. There is another concept which is known as pokayoke. Pokayoke means preventing the mistakes. It's a Japanese concept which says even by mistake, you should not commit a mistake. Mistake proofing. Even a foolish person cannot commit a mistake. Fool proofing. We also call it as fool proofing. Pronounced as pokayoke, although written as pokayoke, but pronounced as pokayoke. Something like this. Preventing the mistakes. Yeah. Preventing the mistakes. Those who are in healthcare will understand why we are showing this. Visual hospital. See, make your hospital visual so that people don't ask questions. Asking a question, the patient comes and asks questions. It wastes his time as well as the staff member's time. It is also waste. Yeah. So some example of mistake proofing. Even by mistake, you cannot commit a mistake. Like, let me show you. Smart machines cannot be set nor operated beyond normal, safe, or maximum levels. And some more examples. You are always well versed with these examples. Abnormal range or values will be rejected automatically. Oxygen cannot be connected to nitrogen cylinders because the connectors are different. And yeah, some more examples are there, which prevents the mistakes. So have those as pokayokes in your hospital. That's what we're talking. Okay, now let's talk about the data. Okay, we have spoken enough about the system thinking, the lean thinking. Let's talk about the data. Okay, data. You cannot improve if you cannot measure. Okay, again, this was given by Edward Deming. Again, Edward Deming said, I hope you remember Edward Deming, a quality guru. He said, you cannot improve if you cannot measure. We also have videos. You can watch these videos. I'll be giving you these videos. They are all there in our Anexas channel. Please subscribe to the Anexas channel. Also, you can connect with me on LinkedIn. So I'm giving you my LinkedIn ID. You can connect with me on LinkedIn. And I keep putting some small clips of tools and techniques. They're not so fancy like typical. I'll try to do it myself, so they're not fancy looking and without much AI and fanfare. A simple, but knowledge is there. So if you are interested, always you can follow me on LinkedIn. So I was telling that yeah. So one thing, as a professional, CPHQ professional, and that's what Dr. Deming said. 85% of the problems are due to the systems and not the people. 85% of the problems are in the systems and processes, not in the people. And the first one is, he said, in God we trust, rest others bring data. Okay.
Changing the people means replacing the people. That also is difficult. And even the changing.
So these detailed descriptions of these videos are very much available on our channel. So I'm not going to the details, but just giving you the essence of it. What do we mean by 85% is due to the systems? And that is why systems thinking will lead you to that. So let's say I put this system into a box, okay? Okay. And I'm replacing the system into a box now. This is the box. This is my system. Let's say this is a large hospital and 1,000 people, or let's say that's not so large, maybe smaller. Let's say 500 people are working in this hospital. Okay. Now you ask any one of the staff member who enters into, I'm just taking a simple example, 8 a.m. they enter, let us say. Few of them, 100, 200 people enter. So let's say general shift, 500 people are working. And you ask them, what is your aim? What today, how many patient complaints you want to receive? What is your target today? None of them will say that, I have a target of today I want to achieve 10, collectively, all my colleagues will achieve 50. They never say like that. They say we'll do our best so that we don't have any complaint. That's what their intention is. From their heart, they never want any error. They don't want any mistake. But what happens at 5 p.m., for an example, when they go out, we have 50 customers. Yeah, this is a typical story of any hospital. The number may vary. Numbers may vary. It could be 50, for some 10, some 20, some 200. So 50 customer complaints. And if you look at this hospital for the last 3 months, 4 months, 5 months, it will be like sometimes 55, sometimes 45. Complaints are like looking like this. Yeah. And if you collect the data for everyday complaints over the last 3, 4, 6 months, you'll find that there are some imaginary limits. Imaginary, this imaginary. The process has decided by itself. Process has decided that I will operate between, say, 35 patient complaints to 65 patient complaints. Process has decided. Who has decided? The process. The system has decided. Not these 500 people. It may appear to you that these 500 people have, in the morning, they collectively take an oath. Today, we'll produce 50 plus minus 15 customer complaints. No, it appears like that. But no, who is producing this? The system is producing. The way we operate our SOPs, the way we have our SOPs, the way we have training our people, the kind of equipment we have, the way we maintain our equipment, etc., 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 etc. All these things which are system related, they decide our errors, they decide our complaints, they decide whatever, whatever is happening wrong to the company. So please understand systems thinking. Again, going back, sorry, I'm coming back to the same topic one more time, but everything is interlinked, right? So once you have a systems thinking, your total perspective will change. You will not blame the people. And you are aware of that. Those who have attended lots of training programs in patient safety, etc., reporting their mistakes, errors, how to encourage the people to report the errors. You have to convince the people the error is not due to the person. Error is due to the system. Go to the root cause. Don't blame the person. Yeah, so that's what I'm saying. By the way, as I was mentioning in the beginning, if we have really good time, I will talk about control chart. But if I don't have, let me tell you very, very briefly that whenever you collect the data of a process, whenever you collect the data of any process, what typically happens is the process, it appears, has got certain pre-decided limit. They are not given by the customer. They are not given by the management. No one told you to produce 35 to 65 customer complaints. Process has decided. We call these limits as control limits. And we have this, we call it as a lower control limit. Lower control limit. Yeah. And this will be upper control limit. I hope you are getting upper control limit. Yeah. Limit. Oh, sorry. Upper control limit. What's happening? Limit. Yeah. UCL, we call it UCL and LCL. Yeah. And if, surprisingly, if you find, let's say, next day, if the complaints are within those limits, we say the process is under control. You'll be surprised. You'll be surprised to know that. Yeah. So as long as we see that process, like you're giving me 35 to 65 complaints every day, I will say statistically, we will say process is under control. It looks very odd, but in statistics, we say process under control. And if it goes above that, suppose you have 80 complaints today, process has gone out of control. It's a bad news. If you have got going lower than 35, process has gone out of control, sir. But it's a good news. I hope you are getting, this is a different concept. That is why people fail in the exam. They don't understand the concept. Please understand. Control limits, control chart. This is called as control chart. What I'm showing you is a control chart. There are different rules of control chart. We will not go into the details, but I'm just telling you the concept. If you go beyond the control limits, either up or down, that means we say processor got out of control. Means something special is happening. Okay. Yeah. Any questions we have? Yeah, I think let me see some questions are there. Yeah. Okay, great. So my team can tell me how much time is remaining. So accordingly, I can plan. If we still have time, I can go. Uh, which topics? There's so many topics. Okay, so my team, if you can tell me, please, how much time is remaining, that would be great. You write write message to me. Okay, great. Actually, I see when I start teaching, it's very difficult to stop me. So the team has to keep telling. Otherwise, like, I can go on and on and on. Yes, coming back. Now let us say when Dr. Deming also said one thing. I'm not going to trust anyone except the data. So you may be having experience. So whatever you say, it has to be data oriented, right? Atib is asking, is this limited decided by VOC and CTQ? Oh, you know a little bit more about it. Okay. Okay, let me answer your question. Okay, it's a good question, so I will answer. Anyway, we will be learning something, right? Please remember, control limit is voice of process. Okay, this is an exam question. Yeah, I think it appears you are preparing for the exam, so you are asking this question. But for everyone's benefit, let me explain that. Specification limit is set by the specification limit is set by it is voice of customer. What do we mean by that? Let us say customer's voice is, suppose you are operating a surgery, you're performing a surgery. Surgery should be performed between, let's say, 30 minutes is the average time, and it should be performed between, I'm just taking an example, say 20 minutes to 40 minutes maximum, right? These are known as specification limits. Specification. What is it? Is voice of customer. Means specifications are given, they are fixed. But control limits are determined by the process, by your performance. So ideal case would be if a surgeon is performing the surgery, the team is performing the surgery, and the control limits are somewhere, let's say, 24 minutes to 36 minutes, right? That means we are really doing well. Process is under control because this is the lower control limit. I hope you are understanding. Upper control limit, lower control limit, upper control limit. And the ones which are in solid lines, this is specification limit. These are specification limits. Okay. And how do you get the control limits? Very easy. Okay, get an average, get a standard deviation, and you add plus then 3 minus. I will tell you that also. Not to worry. But my team has not yet told me that how much time is remaining. If you can tell me that, that will be great. So I can plan my remaining session. Yeah. So now coming back, lower specification. So have you understood? Specification limit is set by the customer. Customer could be the government, customer could be the patient, customer could be your senior management. Specification limit could be set by the healthcare authorities or the scientists or the people who are responsible for the clinical pathways, right? Okay. And natural process variation is control limits. Now, if you are operating like this, very good, but you may be operating like this also. You may be operating like, I'm giving another scenario. Process is still under control, but are you satisfying the customer? No. Process is still under control. Please remember, because control limits, the LCL and now the lower control limit and upper control limits are different. Process is stable. Process is under control, but it is not satisfying the customer. Please, I hope in the shortest possible time, I'm trying to tell you the concept as much as possible, but I hope you have understood. If not, please let me know. Okay. My team just told me it's 15 minutes remaining, so fine. So great. I don't know why I'm not able to see now I'm able to see, yes. So I hope you understood this control charts and control limits, right? And the whole idea of a process improvement project in the beginning, if you remember, we were talking about process improvement project. So if this is the situation, as a CPHQ professional, I would like to improve the process and bring it back to within the specification. This whole thing is known as improvement. Yeah. This is called as improvement. Yeah. I hope you are with me. Please let me know. Yeah. So as a CPHQ professional, our job is to find whether our process is, first of all, under control, and is it within the specification limit also. The control limits also should be ideally within the specification limits. And if not, then we have to take an improvement project. Which processes are not operating within the specification limits? You have to observe. First, you have to collect the data. Without collecting the data, you cannot do anything. So you collect the data, get your average, get your standard deviation, because we have entered into so much of discussions. Let me talk about more. See, if you just collect 30 samples, just 30 samples, from where 30 is coming from, you have to attend my Lean Six Sigma green belt and black belt for that. But for the time being, just trust me. If you just collect 30 samples, let's say patient discharge time, or rather, what I will do, I will show you a project, yeah, a real project that will, after I explain, I'll show you the project. Okay. So the 30 samples, if I collect, and those who are interested, later on, I can talk about FME also, but that will happen after 15 minutes, because 15 minutes, generally 10 minutes is remaining for the regular program, but I'll be still there. If you are interested, please stay on. I will talk more about more tools as well. But just to cover this particular topic, so when you collect 30 samples, most of the processes, they follow this distribution. We call it as normal distribution. And this is known as normal distribution. It looks like a bell-shaped curve. And Gauss, he found one interesting phenomena. Gauss, in 18th century mathematician, he found that most of the processes, if you just collect 30 samples, get an average, let us say, average is, let me explain at least properly that control chart phenomena to you. Let's say time taken to go to the hospital by me is 30 minutes on an average. And if I calculate the standard deviation, now standard deviation can be easily calculated using ChatGPT, Excel sheet, whatever. So let's say standard deviation is 5 minutes. Yeah. And I'll show you a real life example also in a short while. But first understand the concept. Gauss says that you can predict about the whole population from where we have drawn this sample. So I've drawn the sample of my 30 days of travel. Now you can predict about my whole travel, whole year's travel by applying Gaussian concept. Say he says that put here average plus 1 time standard deviation plus 2 times standard deviation and plus 3 times standard deviation here. Minus 1 time standard deviation, minus 2 times standard deviation, and minus 3 times standard deviation here. Now, they are not going to ask you any calculations related to this, but I'm trying to explain a concept to you. In the CPHQ, they're not going to ask you these much detail. They will ask you a question on control chart. But if you know these details, you just look at the control chart and you will answer in few seconds. But if you don't know the concept, then you keep memorizing, then you think, no, I did not do this. You rely on your mock exams. So when you know the concept, you don't have to worry about mock exam. You know the concept. You can answer any question. So what he says, Gauss says, that if I apply this to my example, average is 30 minutes. Yeah. Average is 30 minutes. 1 time standard deviation. So average is here 30 minutes. Standard deviation was 5 minutes. So 1 time standard deviation will be 35 minutes. 30 plus 5. 2 times standard deviation will be 40 minutes. Right? And 3 times standard deviation will be 45. Now, this is the most difficult topic in whole of CPHQ. So I've just gone to the most difficult topic, but because you asked the question, I'm just covering that. And this is 25 minutes, this is 20 minutes, and this is 15 minutes. Because this area is 5, 5, 5. I hope you understood, right? Average. So here, average plus minus 3 times standard deviation. That's what. So average is 30, 35, 40, and 45. So these are the control limits. So control limits are decided by the process. Control limits are decided, like my traveling time of my every day I'm traveling to a hospital. My traveling time is average is 30 minutes, standard deviation is 5 minutes. So my control limits are 15 to 45 minutes. What does it mean? It means that most of the time, the lower control limits, most of the time, you will find me traveling between this time. Yeah, 15 to 45 minutes. 99% of the time. 99, if you want that number also, 99% of the time. 99% of the time, 99% of the time, you will find me traveling between 15 to 45 minutes. So if I take 35 minutes today, you will say, well, process is under control. If I take 25 minutes, nothing special is happening. But if I take 60 minutes, something special is happening. We call it special cause. We call it a special cause. You ask me, I will give you a reason. But 25, 30, 35 minutes, I will not be able to give a specific reason. Yeah. So be aware of this part. So process is under control, out of control. 2, 3 questions are always there. Is the process under control, out of control? And so I've just gave you some information. I've got a video also. You can watch that video later on in our YouTube channel. I'll show you the glimpses of that part.
Problem, but resolution. A final note before I close the data collection topic is that data collection can be time consuming and expensive to office every day.
Yeah, so this is the one I was talking about, right?
Good idea of what is control chart. Let us take.
So this one I have just tried to explain the same thing using the video, and you can always watch that at a later stage whenever you get time. But this video link is I'll send it to you. Not to worry.
A simple example. Suppose.
Oh, yes.
To office every day, and I find that on an average I'm taking 30 minutes and standard deviation is 5 minutes, and we know how to calculate the standard deviation and how to calculate the average. Now if I plot the data on a histogram, Then lower control limit would be minus 3 sigma limits, that will be 15 minutes, and upper control limit would be 45 minutes, that is plus 3 times the standard deviation. So lower control limit being 15 and upper control limit being 45, I can say that my travel time is going to vary between 15 to 45 minutes. So you can expect me to travel to my office every day between 15 to 45 minutes. If someone asks me why this variation between 15 to 45 minutes is there, I can tell him that it is due to common cause variation. What is common cause variation? I can say that the variation between 15 to 45 minutes is due to lots of factors. These factors can be the traffic on the road, the weather, the car I use, my mood, or it can also depend on at what time I start from my home. So a lot of factors, which we can call it as X factors, are affecting the travel time, which is the Y here. So I can make the statement that the variation between 15 minutes to 45 minutes is due to the common causes. Means all the causes are acting on my system and producing this variation.
Just to tell you, see, if you see carefully, traffic is varying every day, route may be varying every day. Every day I'm not taking same route. So these are small variations, and collectively they are producing a common cause variation, which gives me variation which is between 15 to 45 minutes. Now this is unexplainable. I cannot point out very specifically that, why this 5-6 minutes is happening here and there. But when it goes beyond, let's say 60 minutes, I was explaining, right? 60 minutes, I have a special cause. I can tell you very specifically, oh, today there was a heavy rains. Now that is your special cause. Today, today was a holiday and all roads were, there were no vehicles on the road. So suddenly I took 10 minutes. So these special causes have a special reason. So that's what I just wanted to tell. Anyway, this was now those who want to wait a little bit more, I can talk more about other topics also. But before that, before I go, let me answer some of the questions people are asking. If you are interested in joining our sessions, and I can guarantee you'll pass the examination. I'm not just for the sake of telling. If you follow our methods, and after the examination, after the thing, I will also show you some rules, simple rules of analysis after 5 or 10 minutes of small announcements, where many of you who are asking how to join the sessions. So let me tell you about I'll talk about the dates which are available. So every Saturday we are doing the training, and we also have a healthcare Six Sigma program, Lean and Six Sigma Green Belt in healthcare, devoted to healthcare only. That is also taking place on Saturdays. So you can join all our sessions if you want, or you can just join for CPHQ. It depends on what exactly is your aim. Because if you join two, other two comes to you for free. So you can join. This is a training on weekends. Saturdays, we are starting June 27th. Our next batch of CPHQ is on June 27th, July 4, 11, 18. So 4 days. And if you want some special, sometimes we extend the program. So like depends on, questions, etc., interactions. And we have got Lean Six Sigma Healthcare also. We're starting for 1st August. Those who are only interested in Six Sigma, they can join that. Those who are interested in both CPHQ and Six Sigma, they can join both. And those who are only interested in CPHQ, they can only join the CPHQ. And Lean and Six Sigma Green Belt and Black Belt is an open book examination. So there are no failures. So you definitely become a Green Belt or a Black Belt. But yeah, we teach you some real good tools and techniques. More than the certificate, it helps your organization to save costs. Similarly, CPHQ, it helps in your career. A lot of positions in hospitals, I know in Middle East, in Australia, and in Europe, and right now we don't have US candidates because there's not time. I also conduct the program for US. If someone is joining from US, we conduct the training program. These dates are not for the US program. These dates are for Middle East and programs in India, Middle East, and that time zone, European time zone. So, but I do conduct for US as well. Different dates are there, and I will talk about that in a different program which is devoted to the US. So when you are joining our training program, you can, as I was telling, that your success rate definitely will be high, and you can attend our multiple programs also. Like if you want to, suppose you're not able to appear for the exam in the next 3 to 4 months, again you can appear for the again you can uh, attend our training programs free of cost. Like once you are a student, you remain a student throughout. People who have attended my training programs 10 years ago, 15 years ago, they still keep attending today just for a refresher course, including some of the ministry officials as well. And yes, so these were all things which I just wanted to tell you. Any question, uh, my team would like to show something else as well. Yeah, so these are the course fees. So if you just want CPHQ, you have 999 if you do it today. And very, very special offer. It's sort of almost 50% discount. And if you go for both CPHQ and Lean Six Sigma in healthcare, green belt, it is 1499. And if it is all the three, CPHQ plus Lean Six Sigma, green belt, and black belt, it is 2499. And these certificates are recognized worldwide. You'll get a QR code, and they are all accredited certificates worldwide. It's international certificates provided, and we are all affiliated to uh, all the certifying bodies and CSSC. Then we have got PMI, those who are interested in PDUs, etc. So lots of accreditations are there, and more importantly, those who want to appear for CPHQ certificate, guarantee is there. No, not 100%, but I can say 90-95% guarantee that if you follow what we say and don't read too many books, just focus on the material provided to you and understand the concepts, ask questions, and we can assure you that you will get your certificate. So with that, those who want to still stay on, they can stay on, and those who want to because I know the time for the program is over, the scheduled time is over. So those who want to, those who have some other engagements, they can proceed further. So I wanted to talk about, I think today I spoke about control charts, the basics and essence of control charts. And now let me show you some, let's expand it a little bit more. Just knowing the process is under control or whether the process is satisfying the customer or not is not enough. You have to improve the process, isn't it? So there are different tools. Now let me show you the some project. Let me say patient discharge time. So that will help you to learn some tools and techniques also. I'll just take you through those tools. Yeah. Using ChatGPT also, you can do this analysis. Nowadays, life is very simple. Put your data, put in the ChatGPT, and you can do these graphs in few clicks. But at least you should be able to tell the ChatGPT that you want a control chart. If you don't ask that, ChatGPT will not deliver that to you. So, so here, let's say I want to reduce the patient discharge time in the hospital. And if I show you this, no. So discharge time of patients is 5 hours, and you want to reduce to 2 hours. So this is our project charter. So always, as a quality professional, you write a project charter. Always, you start with the project charter. one or two questions will be there on your project charter, like what is a goal statement, what is a goal statement, SMART, SMART, SMART goal statements. Very popular question in CPHQ. SMART, specific, measurable, achievable, relevant, and time bound. Yeah. So it should be a good goal statement. So yeah, so I'll just show you the glimpses of that. So once you have got your charter, you then collect the data. So we collected the data. Let's say we collected the data in minutes. How much time it takes to, uh, you know, uh, to discharge a patient. Now, what I'm doing, CPHQ will not ask you, exam will not ask you to do this, whatever I'm doing right now. Although, if you are interested, we teach that also in the class. Nowadays, ChatGPT can also do all these things. So, no big deal. But they will ask you the question on the output. Say, for example, I do a histogram. So, what is the average? 300 minutes. What is the standard deviation? 25 minutes. Now, if you remember, control limits you can calculate. 300 plus 3 times 25, 25, 20, 25 and minus 3 times 25, 25, 25. So 75. So 300 plus 75 and 300 minus 75. Approximately, I'm telling. This is your control limits. This down below is the box plot. I've not taught you what is box plot, so don't worry about it. But all these things, see, CPHQ will give you the output. They will ask you questions about it. We will explain in the class what do you mean by a histogram, what do you mean by average, what do you mean by standard deviation. Even you can see whether the process is under control or not. So CPHQ, like I'm just drawing a control chart on this and this data. CPHQ will give you the control chart and ask you whether, let me show you this. So this is patient discharge process, control chart. Lower control limit, automatically it is calculated. And automatically it is, upper control limit is also calculated. The question will be, is the process under control? The answer here will be yes, process is under control. Okay. Then there are other rules also of if it points are going up continuously for 6 times, even though it is within the control limit, still it could be out of control. All these things I'm not discussing now, but very, very basic things I'm talking. So 3-4 questions on control chart for sure they are going to be. Then our purpose is to reduce it. So what is causing your high patient discharge time? You do something called, we call it as cause and effect diagram. Okay. So you brainstorm cause and effect diagram, man, machine, material, method, man, machine, material, method, all these things. Fishbone diagram also we call it. So you brainstorm with the help of the team, what is the causes of problem? Or you can use ChatGPT to brainstorm on the causes. With the help of ChatGPT and the team, see, both should work in sync with each other. You should not only rely on ChatGPT, you should not rely only on the team. Both should work. So when you do that, you get a cause and effect diagram. Now, cause and effect diagram might be given to you in the examination. They may ask you which diagram it is, what is the name of this diagram, like fishbone, Ishikawa diagram, cause and effect diagram. These are 3 names. Or what is the purpose of this diagram? You are doing a root cause analysis. There's another technique called 5 why. Why? Ask why 5 times. Why patient discharge time is high? Because of this. Why it is, why staff, suppose I say staff not available. Why staff is not available? Because there is no schedule. Why There is no approval process for the leave. Whatever. Why? Ask why 5 times. You'll get to the root cause. So all these things, you'll be learning. Now, this is one. After that, let's look at which cause is occurring most of the time. So you first collect the reasons for delay. 50, 60 times the delay happened. You assign a reason. You will find some reasons are always assigned more. Some reasons are assigned less few times. You can create a table. How many times? How many times? You can create a table. How many times it is? How many times it is created the this thing? How many times you have created the made these causes? How many times this frequency of occurrence of the causes, the reasons? Maximum occurrence is happening, reporting not accurate. If you see reporting accuracy is the main cause. So you can organize them into descending order. Pareto chart. We call it 80-20 rule. Pareto chart, right? 80-20 rule, Pareto charts. Have you heard of Pareto charts? Mr. Vilfredo Pareto was an Italian economist. Mr. Vilfredo Pareto was an Italian economist who found that 80% of the wealth in Italy was with 20% of the people. 80% of wealth was with 20% of the people. And reverse is also true. 80% of the people had got 20% of the wealth. 80-20 rule. We call it 80-20 rule. So Joseph Juran, another quality guru, he applied this to quality. And he said, 80% of your problem, whatever you are trying to solve, is due to 20% of the causes. So if you listed 10 causes, only 20% of 10 means 2 causes are responsible for 80% of your problem. This we call it Pareto chart. In our training programs, we tell you how to draw a Pareto very nicely. We take some time on it. But right now I'm just showing you. Nowadays, ChatGPT is there, tools are there. They will not ask you to make any chart. Okay. CPHQ doesn't expect you to make a chart. You should be able to interpret. They will give you a chart. They will give you a chart and you should be able to give answers. So for example, reporting not accurate, maximum time it is happening. Staff not available, maximum time. Pharmacy delay. And this percentage contribution is also, which percentage? The first cause is contributing 29%. Second cause is contributing 25%. First 2 causes together is contributing 54%. First 3 causes are contributing to 67%. So this line, the line which is going up, is the cumulative line. Means it is adding up. It keeps on adding the bars. So you can find that 80% of the problem is due to these first 3-4 causes. So we teach you in our training session, first of all, how to prepare the control chart, Pareto chart, then how to interpret the Pareto chart, then how to answer the question. So 2-3 questions are there in the Pareto chart. Okay. So if you know the basics of Pareto chart, if you know the fundamentals of Pareto chart, then any question you can answer. You don't have to practice mock exams related to Pareto chart. You can create hundreds of questions on Pareto chart. But if you know what is Pareto chart, what this line is telling, what these bars are telling, the bars on the left side are contributing the most issues. So the question could be, which is the root cause of delays in patient discharge from this particular diagram? Or if you are working on reducing the patient discharge time, which cause you will attack first? Okay. So something like that. So you can answer the question. So this is how you can, answer. Yeah, so I think I have some people are asking till when is this webinar? This webinar is over actually, but I'm just taking extra sessions. But yeah, I think you have also a lot of work to do. So I keep doing these sessions. You can also join our other sessions in future. Just let me know in case you are interested. And also, once again, my team can show you the dates. You can register. If you want to register, we have got a registration link also. You want a certificate also, we have a link where you can register. We will send you we'll send you a email, and using that email you can always uh, you know get the certificate. So log in and get the certificate. um, I hope it was useful to you. I hope you got some picture. The idea of today's seminar was not to teach you the tools in detail. I was little fast. I was trying to give you more bigger, high-level knowledge uh, in in the limited time. So it may have appeared that I'm little fast, but the idea was to give you the bigger picture. I hope you were able to get some uh, some good knowledge out of it. But when you come to my session, we are very slow. Slowly we draw, we keep asking, interacting. We have lots of questions. And the idea is that you should understand the tool. Once you know the tool, you can answer the question. Then you don't have to waste too much time in reading hundreds of pages of books. If you know what is Pareto chart, you can answer 20, 30 questions on Pareto chart. If you know what is a histogram, you can answer 20 to 30 possible questions. Now, I'm not saying they will ask 20 questions from Pareto, but I'm saying possible questions. They will ask only 2, 3 questions. But you don't have to study 40 questions on Pareto chart just to prepare for Pareto chart. So the whole idea is to understand the concept, then answer any questions on earth. Okay. Thanks a lot, Maz. Thanks, Maz is there. Delise, Kalpana, uh, Jyoti, thanks a lot. Mohammed, Mr. Mohammed, thank you. Yeah. And do attend my trainings as well if you are interested and if it is within your budget. Otherwise, subscribe to Anexas channel. A lot of tools have already put in. Lot of tools I have already put it. Cause and effect diagram, box plots, Pareto chart. My team was giving links also of these tools. If you are interested, you can always watch those videos at any time, and also connect with me on LinkedIn, and you can download your certificate of today's program and post it on LinkedIn also if you want. And yes, uh, so you can. I'll be happy to connect with you on LinkedIn. And teaching is my passion, so I keep doing it. Although my family members keep telling my wife is a doctor, she is the pediatrician. She keeps telling that I should retire now. But because the doctor doesn't retire, so why should I retire, right? Okay, great. Um, mm, yeah, so Mary, looking forward to meet you also very soon. And uh, thank you. Thanks a lot. Yes, Mr. Mohammed, thank you. Thanks a lot. Mm, yeah, the seminar is over now. Yes. But yes, our team, yes, we can show you some videos which talk about some of the success stories of our students. A lot of students have sent us videos. Maybe we'll show you some videos so that you get the confidence that we really are good. It's just not like that, talking like that. Yes, let me show you. Our team can show some uh, videos related to some of the what students are saying. So lots of hospitals I also do training programs in hospitals. So if your hospital has a batch for 10 people, 15 people, 25 people, I can do the training for you as well. So you can get it done that way as well. Yeah.
Hello friends, I'm Dr. Jyoti Bala and I have recently cleared my CPHQ examination with a wonderful score of 88%, and I'm really grateful to Mr. Amitabh Saxena and all his team. So Anexas has done a wonderful job training me for CPHQ exam. I could crack the exam pretty easily. The materials provided were very up to the mark, were very appropriate. I mean, I really had to work hard with them for a couple of months, but it wasn't that difficult as such, and I really wish all the candidates great luck, whoever are appearing for CPHQ examination, and I highly recommend Anexas training for the same. Thank you.
There was a hospital, Sidr Hospital, I remember, in Qatar. So a lot of batches we did, and they were all 100%. Every batch was 100% passing the exam. And KSUMC also the same.
Completed
Yep.
3 days training of the CPHQ, which has been absolutely fantastic. Amitabh from Anexa has been phenomenal. The course materials have been fantastic. I think what I really enjoyed about this was that I could relate a lot of this methodology to healthcare, and a lot of the examples were things that I could contextualize it with healthcare. So I'm from here in Qatar at Sidra Medicine, and so again, thank you to Amitabh for this fantastic training.
Hello everyone, future CPHQ professionals. I just want to give you a bit of an idea of our last 3-day course on the CPHQ exam preparation. It was awesome. We covered the majority of the topics in a very targeted and focused way that allows us to later on focus our studying and our energy and our time on what really is of value for the examination, but more importantly as well, because of the practical examples that Amitabh was able to provide us in our everyday healthcare work. One thing that I really benefited from the course is that Amitabh from Anexas was able to provide us with answers and solutions, especially at the statistical level, to questions and problems beyond the CPHQ course, to exercises and projects that we do in our everyday work life. For that, I would definitely recommend the course, taking it with Amitabh and Anexas. It's been a great experience, both for my preparations for CPHQ, but more importantly for my everyday work. Thank you so much.
Yes. So right now I just met one person who has cleared the CPHQ examination, Dr. Shahnawaz. And
Yeah.
yes, doctor, you would like to say something about?
Yeah, I am Dr. Shahnawaz. I am a family medicine registrar currently working in Saudi Arabia. I got the training from Anexas from Bangalore, and I cleared my CPHQ exam 3 years back. It was so grateful for Anexas for training me.
Thanks a lot, doctor, and best wishes to you. He is in Riyadh right now, and we just met him in Riyadh. Thanks a lot. Thanks a lot.
Undergoing a CPHQ training is like keeping pace with the quality standards and advancements in the healthcare sector. The CPHQ certification is a credential that signifies both professional and academic achievement for those who are in healthcare. Certified professionals in healthcare quality, that is CPHQ, can be taken up by anyone who is in healthcare profession or wants to pursue a career in healthcare. Once you are a CPHQ certified, it will signify that you have the specific healthcare quality skill set and knowledge that can make a difference in improving outcomes across the healthcare sector. There is no eligibility requirement to sit in the CPHQ exam. The CPHQ exam consists of 125 multiple choice questions which are scored and 15 multiple choice questions that are not scored. You are allotted 3 hours to take the CPHQ exam. The score needed to pass the CPHQ exam varies each year based on the difficulty of the exam. On an average, you need to answer approximately 70 to 75% correct to pass the exam. We at Anexas have trained more than 3,000 CPHQ professionals, and we can also help you to write your exam successfully. Here are some few tips from us for exam preparation. First one, regarding time management. You don't have to study thick textbooks and 5 different test preparation materials to pass the exam. We provide you with all the material required. Using Pareto's 80-20 principle, we have segregated 20% of the most important material and we tell you to study that. Just read it and solve some mock exams, which of course we are going to provide you, and you are ready to appear for the exam. After attending our course, if you want to revise again, you can join our course once more without paying any online training fee. All the best for your exam.
Hello everyone. Let us learn about a very common concept that is so crucial that many companies that fail to understand correctly don't go very far in terms of success. We are going to talk about change management and its importance. So to begin with, we all know what a change is, something not many people like. How important it is to adapt to a change? Does change management really affect the organization? Change management is a systematic approach to deal with the change or transformation of an organization's goals, organization's processes, or organization's technologies. The focus of change management is to execute the strategies for affecting the change, controlling the change, and helping people adapt to the change. Why change management is important? It is important because failing to adapt to changes will not only cause downfall, but also if companies and organizations don't change positively, then how will the world progress? Let me take a very famous company. I'm sure you all would have heard about Toys R Us. The company controlled 25% of the global toy market in 1990. The reason behind their downfall was the failure to adapt to change to new technology. Unlike its competitors, which were embracing new technologies and innovation to adapt to the changing preferences and buying habits of the new generations, Toys R Us failed to adapt and ultimately lost its global power. We all know a similar story about Nokia too. When a company so huge can have a downfall due to lack of change management, then it is a lesson we all must learn and should not take change management lightly. Let us now talk about different types of changes. Changes can be broadly classified into 3 types: transitional change, development change, and transformational change. Traditional changes are performed by senior management to steer the company from one direction to another to make sure that the problems that the company is facing are resolved. Development changes are changes that are made in the company's policies to make sure that the already established processes work at optimized efficiency. Traditional changes are the changes which create most impact. They change the fundamental concepts on which the company is based and also the operations and the core values of the company. Most popular model of change management is Lewin's model, which has 3 stages: unfreeze, change, and freeze. Let us look at them one by one. The first one is unfreeze. The first stage of change involves preparing the organization to accept that change is necessary, which involves breaking down the existing status quo and creating dissatisfaction with the current performance. The management needs to issue a compelling message showing why the existing way of doing things cannot continue. This is easiest to frame when you can point to the declining sales figures, poor financial results, and worrying customer satisfaction surveys. You need to change the beliefs, values, attitudes, and behaviors that currently define it. Using the analogy of a building, you must examine and be prepared to change the existing foundations, as they might not support add-on stories. Unless this is done, the whole building may risk collapse. When you start questioning the way things are done, you put everyone and everything off balance. You may evoke strong reactions in people, and that's exactly what needs to be done. Now you effectively create a controlled crisis, which in turn can build a strong motivation to seek out a new equilibrium. You get the buy-in and participation necessary to effect any meaningful change. The second stage is introducing the change. After uncertainty created in the unfreeze stage, the change stage is where people begin to resolve their uncertainty and look for new ways to do the things. People start to believe and act in ways that support the new direction. In order to accept the change and contribute to making it successful, people need to understand how it will benefit them. Here, there will be resistance to change which needs to be dealt with. I've talked about strategies to deal with resistance in another video. Time and communication are the two keys to the changes occurring successfully. People need time to understand the changes, and they also need to feel highly connected to the organization throughout the transition period. When you are managing change, this can require a great deal of time and effort, and hands-on management is usually the best approach. The third stage is refreeze. When the changes are taking shape and people have embraced the new ways of working, the organization is ready to refreeze. The outward signs of the refreeze are a stable organization chart, consistent job descriptions, and so on. The refreeze stage also needs to help people in the organization internalize or institutionalize the changes. This means making sure that the changes are used all the time and that they are incorporated into everyday business. With a new sense of stability, employees feel confident and comfortable with the new ways of working and don't go back to old habits. As part of the refreezing process, make sure that you celebrate the success of the change. This helps people to find closure, thanks them for enduring a painful time, and helps them believe that future changes will be successful. So that was all about change management. Don't be afraid of adapting to changes. After all, it is not the strongest or the most intelligent who will survive, but those who can best manage the change. Happy learning!
Happy learning! Thanks for taking out time to watch this video. To learn more, check out our other videos. Link is given in the description below. Subscribe to our YouTube channel and have a great day. For more information you can write to us on inquiry@anexas.net.
We humans have a very strange quality. You can call it self-respect, ego, pride, or the will to prove oneself right. This can be a common cause for a rise in conflicts. In an organization where there are many people working together, where some actions affect others, conflicts can occur more than frequently. And this is why conflict management is an extremely important subject to understand, so that harmony can be maintained in the company at all times. Let me ask you a question first. Are conflicts good or bad? Well, some of you may say, how can conflicts be good? Over the period of time, views on conflicts have changed. It was an old view that conflict is dysfunctional and caused by personality differences or a failure of leadership. Conflict is to be avoided, or conflict is resolved by physical separation or the intervention of upper management. Well, that was an old view. The new view is conflict is inevitable consequence of organizational interactions. Conflicts can be beneficial. Conflicts is resolved through identifying the causes and problem solving by people involved and their immediate manager. They can also be solved by referring to ground rules framed in the team charter, which was created at the beginning when the team started working together. Let us first understand what are the different types of conflicts. Conflicts can be divided into three main categories: task conflicts, relationship conflicts, and value conflicts. The task conflicts often involves issues related to an employee's work assignments and can include disputes about how to divide the tasks or resources, and also it can include different opinions about the work. Of the three conflicts, task conflict may appear to be the simplest to resolve. However, task conflicts often are more complex than they appear to be and need to be handled carefully. Some of the sources of conflicts are schedules. Someone told you that he will finish the work in 10 days and he didn't. This will result in a conflict. If you see carefully, your team or organization will benefit from this conflict because you are questioning the inefficiency. Priorities. Different people have different priorities. Maybe work that is important for the organization or a project, in your opinion, is not as important for someone else. Resources. We have limited resources. Two people might compete for the resources. Hey, I need that IT guy for 2 weeks. The other person says, sorry, he's not available. There's a conflict. Technical opinions. Technical opinions might be different, which might lead to conflicts. It is always good to explore all the possibilities in interest of the organization, and such conflicts can be good. Administrative procedures. People might not understand administrative procedures and might argue about it. Cost. Someone promised you that he will complete a job within the budget of $5,000. But now there is a cost overrun. Questioning would lead to conflicts, but would benefit the project or the organization. That was about task-related conflicts. Let us now look at relationship conflicts. This type of conflict arises due to differences in lifestyle, opinions, personality, and thoughts. In an organization, people with a vast range of lifestyles need to work together to reach certain goals. These people might not have common viewpoints or opinions, but still need to work in unison. It is obviously no surprise that relationship conflicts can be common in organizations. Value conflicts. This type of conflict arises from fundamental differences in identities and values. For example, differences in political, regional, and ethical thoughts or other deeply held beliefs. These types of conflicts can be difficult to resolve. But as they say, nothing is impossible. So let's see some of the conflict management strategies. Well, there are many different types of conflict management strategies, but I'm going to discuss the 5 major strategies. Before beginning, you must note one thing. Each strategy has its own benefits. There is no right or wrong conflict management style. As long as the style works for you, it can be called as perfect conflict management strategy. The first strategy is problem solving. Here, you confront the problem and solve it by identifying the root cause. For example, to resolve a conflict with a colleague in a project, you might say, well, it seems that the real problem here is not lack of communication, but lack of knowledge of what needs to be done and when. Here is a copy of the project schedule. It should let you understand what you need to know. The next strategy is collaborating. Collaborating involves a combination of being assertive and cooperative. Using this strategy, both sides can get what they want and negative feelings can be minimized. This strategy gives the best results when long-term relationships and outcomes are more important. For example, if 2 people want to lead the same project, you can divide the project into 2, and then you can divide the responsibilities into 2 and ask each of them to lead their respective teams while collaborating. This is a win-win solution. The next strategy is competing. It involves a combination of being assertive and uncooperative, when one aims to pursue their own concerns at another person's expense. This strategy can be used when you don't care about the relationship, but the outcome is more important. We can call it as a win-lose strategy. Like when we play a game, the focus is on winning. For example, when you wish to compete with another company for a new client, this strategy can be used. However, don't use the strategy in your own organization, as the strategy does not help build relationships. Yet another strategy is avoiding. Avoiding involves a combination of being unassertive and uncooperative. You can diplomatically step aside from an issue or withdraw from a threatening situation. This strategy should be used when you don't wish to immediately solve an issue but want to wait for the right time to solve the conflicts. The next strategy is accommodating. Accommodating is the opposite of competing strategy. There is an element of self-sacrifice here. Now, this may seem generous, but it could take advantage of the weak and cause resentment. This strategy can be used when you don't really care about the outcome but want to preserve the relationship. Maybe this relationship will give you long-term benefits. The next strategy, compromising. It aims to find a convenient and mutually acceptable solution that satisfies both parties to some extent. This strategy involves a combination of being a little assertive and a little cooperative. This strategy can be used when the outcome is not very important and you do not have enough time in hand. For example, to resolve a conflict between two persons, you can say, "Let us do a little bit of what both of you suggest." And the last strategy is forcing. It is about pushing one viewpoint at the expense of another. Do it my way, or sometimes, as many people say, my way or highway. The bosses often use this. As I said earlier, it's not that one strategy is better than the other. It depends on the situation. But in my opinion, problem solving that means confronting a problem by solving its root cause is the best one, if that is a possibility. Conflicts can be a part and parcel of your daily work, and this is why you should not be afraid when conflicts arise. There are things you can do, such as becoming more skilled and qualified in managing the conflicts. I hope this video helped you. For more videos like this, you can subscribe to my channel.
Happy learning! Thanks for taking out time to watch this video. To learn more, check out our other videos. Link is given in the description below. Subscribe to our YouTube channel and have a great day. For more information, you can write to us on inquiry@anexas.net.
So if you have any no more questions, then we can wind up the session for the day. Thank you once again for attending our session, and waiting for you to join our session very soon. Thanks a lot. Yeah, the subscription is free. I think Mohammed, you were asking. Yeah, subscription is free to Anexas channel. You can see all the material there also. This training certificate, I think you will receive an email and you just click on the link and you will get the certificate. Yes. In the email, you will receive a link, and that link will give you the directions how to get the certificates. In your email, that's right. My team can just tell me, is it the right thing I'm telling? You'll receive a link in your email. You'll receive an email, and